Good morning, everyone, and welcome to the 2020 Annual Community Health Improvement Planning Meeting. Thank you for being here with us. My name is Karen Weller. I am the Director of the Office of Community Health and Planning here at the Florida Department of Health in Miami-Dade County, and I'd like to welcome you to our Annual Community Health Improvement Plan meeting. From now on, I'll be referring to this meeting as the CHIP meeting because of its long name. The annual CHIP meeting event is designed to provide a high-level, dynamic sessions that review the 6 strategic priorities for public health. During our meeting today, we will provide a comprehensive overview of the status of the Miami-Dade County CHIP, and you will have the opportunity to discuss the issues impacting health and wellness in Miami-Dade County and evaluate the strategies and actions that address public health issues and have opportunities to offer innovative ideas. Before we begin, however, I would like to have a few housekeeping items for you today. As a reminder, participants are in view and listen only mode and will be unmuted for the discussion activity later on during the session. There will be no camera options. At this time, all participants are muted. You can, however, type your questions in the chat box as we have someone monitoring all of the questions and answers, and we'll have a question and answer session at the end of the event. The location of the chat box is under the Questions tab. Under the Attachments tab on the side of the screen, you may access the meeting materials for today, which is the agenda and the presentation. Lastly, if you're experiencing any technical issues, please contact Robert Ward at robert.ward@flhealth.gov. We have also included this information in the chat box. Again, I want to thank you all for being here with us today. Now, to start our event, I'd like to introduce Dr. Vilalta. Yesenia Vilalta is currently the Administrator and Health Officer for the Florida Department of Health in Miami-Dade County. She has been with the department since 2005, where she provides oversight to public health activities for the department. Dr. Vilalta is an advanced practice registered nurse and has been in the nursing field for 20 years. Dr. Vilalta is a 3-time graduate of the University of Miami School of Nursing, where she earned both her bachelor's degree, master's degree, and she has as well the Doctor of Nursing practice degree. Dr. Vilalta is focused on public health issues, clinical practice, and quality improvement and performance management. She has also been actively involved in the agency's performance and quality journey by sharing and leading various work groups and quality improvement projects, taking lead roles in public health accreditation and the Sterling Performance Excellence site visits. She also participates in various community and nursing advisory boards. I would like you all to please welcome Dr. Vilalta.
Good morning, everyone. I hope you can hear me. Good morning and welcome to the 2020 Annual Community Health Improvement Plan meeting. Thank you for being here. I'm so glad that you all joined us this morning. The mission of the Florida Department of Health in Miami-Dade County is to protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. At the Florida Department of Health in Miami-Dade County, population health is our priority. We work to support and strengthen policies, systems, and environments to improve population health. We strive to be the healthiest state in the nation. Due to DOH Miami-Dade bearing responsibility for protecting the health of public, the staff developed a Community Health Improvement Plan, also known as the CHIP. This was done in partnership with local community members and organizations. DOH Miami-Dade staff is responsible for the ongoing monitoring of the CHIP, which plays a vital role in carrying out our core values. The coordinated approach we take to improve health has resulted in an interactive, vibrant, and collaborative health system. DOH Miami-Dade is only one part of the public health system. Other agencies, non-governmental organizations, institutions, and informal associations play critical roles in creating conditions in which people can be healthy. We understand that leading residents to better health requires a multidisciplinary approach, including the collective strengths of individuals, communities, and various social institutions working together to improve health. The Miami-Dade County Health Improvement Plan was developed by a broadly defined public health system, which includes the public, private, and voluntary entities that contribute to the health and well-being of the residents of Florida. The CHIP is designed to promote collaboration, coordination, and efficiency. The plan identifies 6 strategic public health priority areas that were chosen by the community, each with their own goals and objectives that result in positive health outcomes. It highlights the many activities with the public health network that contribute to the community health improvements, which address the most pressing concerns facing our community. Most of us know that to stay healthy, we have to do many things, like eat a balanced diet, exercise, receive the recommended immunizations, avoid smoking, and definitely seeing a doctor when we're sick. What many do not know is that our health is shaped by the social, economic, and environmental conditions in which we live, such as the quality of our schooling, the cleanliness of our water, food, and air, the economy in which we work, with the community resources that we have access to. As we go forward with the CHIP, it is important to address the conditions that contribute to our health rather than only treating medical conditions after they occur. Our CHIP is the performance measurement tool used to determine our progress in improving community health. We have developed a CHIP annual report to evaluate the current status and progress that we are having within our community. With the CHIP, we envision a community where health equity is achieved, care is accessible, chronic disease is prevented, maternal child health is improved, injuries are reduced, and communicable diseases and emergent threats are treated and prepared for. With more than 120 indicators, the CHIP brings us closer to the Miami-Dade community that we envision. We're all part of this community. Let's work together to make Miami-Dade County the healthiest that it can be. Finally, before we proceed through the rest of today's activities, I want to acknowledge several of our elected officials who are present here today. Senior Advisor of the Miami-Dade County Office of the Mayor, Ms. Miriam Marcus, as well as the Honorable Mayor of South Miami, Mayor Sally Phillips. Thank you and have a wonderful rest of the morning.
Thank you so much, Dr. Vialta. Good morning, everyone. I'm Candace Schottenlohr, and I'm a health educator here with the Florida Department of Health in Miami-Dade County in the Office of Community Health and Planning. Today, I'll be sharing with you on the Mobilizing for Action and through Planning and Partnerships process, also known as the MAP process, which I'll refer to. So what is the MAP process? The MAP process is a community-driven strategic planning process used for improving community health by identifying strategic issues from 4 assessments and using the community concerns and issues to set priorities and implement evidence-based initiatives to advance health. This is facilitated by public health leaders, and this framework helps communities apply strategic thinking to prioritize public health issues and identify resources to address them. MAP is not just an agency-focused process, it's rather an interactive and dynamic one that can improve the efficiency, effectiveness, and ultimately the performance of public health systems. In the MAP process, there are a total of 6 phases. As you can see on the screen, phase 1 is the beginning where we organize for success and partnership development. Phase 2 is the visioning process. Phase 3 is 4 MAP assessments that make up the process. Phase 4 is identifying the strategic issues. Phase 5 is formulating goals and strategies. And phase 6 is really the action cycle step. And today, I'll go ahead and highlight phases 3 and 5 in more detail. And this process has aided in the development of the Community Health Improvement Plan. So phase 3, this phase consists of the 4 separate MAP assessments, and this includes the local public health system performance assessment, which really assessed the local public health system here in Miami-Dade, the forces of change assessment, where we assessed any changes in the community, the community themes and strengths assessment, where we conducted the focus group discussions with community residents, as well as the well-being survey that was conducted here in Miami-Dade. And lastly, the community health status assessment was conducted. Individually, the assessments yield an in-depth analysis of factors and forces that affect population health. Taken together, the 4 assessments created a comprehensive view of health and quality of life here in Miami-Dade County. The results of the assessments determined the new health priorities of the Community Health Improvement Plan that was released last year in 2019. And this is our 5-year local plan for public health system partners and stakeholders to improve the health of all residents. So once the MAP assessment was completed, this allowed us last year, when the community came together, to vote and identify the strategic health issues and to identify broad strategies for addressing issues and achieving goals related to the community's healthy vision. And the 2019 to 2024 health strategic priority areas that were voted on included health equity, access to care, chronic disease, maternal child health, injury safety violence, and communicable diseases and emergent threats. So we're here today to discuss the CHIP, and as we mentioned, this 5-year plan is used for improving community health and the quality of life in Miami-Dade, and the CHIP sets out goals for the Miami-Dade County public health system, which includes a range of stakeholders such as state and local government agencies, healthcare providers, employers, community groups, universities and other schools, nonprofit organizations, and advocacy groups. The department uses a collaborative planning process to foster shared ownership and responsibility for the CHIP's implementation, with the goal of efficient and targeted collective action to improve the health of all residents. This comprehensive assessment ensures that the priorities selected for the CHIP are shaped by data about the health status of our residents, the effectiveness of the Florida's public health system in providing essential services, the residents' perceived quality of life, and how factors outside of health, might impact health now and in the future. And so the CHIP is aligned at the national and state level. At the national level, we use the Healthy People 2020 and the newly released goals for Healthy People 2030 now. And at the state level, we use our State Health Improvement Plan, also known as the SHIP. And so we make sure that we are in alignment with all these levels. And so most importantly, in this process, the success and working together is really crucial and critical to this process. And on this slide, you can see it's our classic jelly bean model that we use in public health. And it shows all the important partners who should be and that have been a part of this process. And community members really have that profound insight into what supports and undermines healthy living. And additionally, representatives from like housing, transportation, advocacy groups, as mentioned earlier, universities and schools are important partners in this MAP process. And so it's also important for us to keep in mind the Robert Wood Johnson Foundation Culture of Health Action Framework. And we're here, to serve the community, and working together, we're stronger than apart. And so at this time, I would like to thank you all for being here with us today and a part of this continuous process. Thank you so much. And now I will welcome Robert Ward to share some information on the state revision updates.
Thank you, Candace. The next 2 slides will discuss revisions to the Community Health Improvement Plan, also known as the CHIP, and the Community Health Assessment, also known as the CHA. The revisions are based on feedback delivered by the state of Florida in July 2020, and we will discuss the CHIP first. The first revision made, we revised approximately 50 objectives to be SMART. SMART is an acronym that is used to guide the development of measurable and achievable goals. SMART stands for specific, meaning each goal has a clearly outlined purpose and defined end result. Measurable, each goal has a target that is measured over a set time frame and at set time intervals. Achievable, can the goal be realistically accomplished in the given time frame with available resources? Relevant, does the goal and outcome fit with the overall plan it is a part of? And time-oriented, the goal can be measured on a regular basis and has a set endpoint. Our next revision, we added needed policy changes to each priority area. For example, under the health equity priority area, we included that changes are needed to increase affordable housing availability, healthier food options, and age-friendly shared youth paths. In addition, adoption of resolutions that reduce tobacco use and promote and advance health equity throughout the community are needed. Finally, we included a new chart showing alignment with Healthy People 2030 goals. Healthy People 2030 was released in August 2020 and builds on the goals in Healthy People 2020. The chart outlines how the CHIP maintains alignment with Healthy People 2030. Healthy People 2030 is a work in progress, so we foresee further change to the CHIP as we move into the future. So with our revisions, I'm happy to report that we received a 100% score from the state. So now I'll discuss the CHA. The first revisions we did, we added 4 new sections to the document. The first section is called Disparities in Miami-Dade County. This one-page section describes the health equity challenges facing significant portions of the county's residents. For example, Black and African American populations have significantly worse health outcomes than whites when looking at years of potential life lost. There's also a large food insecurity problem in Miami. Roughly 10% of households meet the definition in 2017, and almost 20% of children in Miami-Dade County lived in food insecure households. The section we changed was a local resources tab that we added. This one-page section outlines organizations found only in Miami-Dade that work to improve the health of the local population. DOH Miami-Dade recently compiled a list of local providers into an interactive community resource map that is available online. The resources listed here are primarily located in the Homestead and South Miami region, since this area has been identified as an area of high need. However, many of these organizations have footprints that extend throughout the whole county. The third section we added is the Community Health Assessment Indicators 2030. This 2-page chart lists Healthy People 2030 goals and corresponding indicators that indicate whether that goal has been met yet or not. Finally, we added the 10 essential public health services. This is a 1-page section, and the public health goals provide a framework for public health to promote health of all people by actively improving policy, systems, and services that enable positive health outcomes. It also seeks to remove systemic and structural barriers such as poverty and racism that have resulted in health inequities. So the goals were revised in September 2020, and the biggest change in this revised version is a new emphasis on health equity. We also added 8 new indicators. There are 5 new ones under maternal and child health, and 1 each under reportable infectious diseases, chronic disease, and health factors. Finally, we included a new chart showing alignment with Healthy People 2030 goals, just the same as in the CHIP. So I'm also happy to report that we received a 100% score from the state, so we are very pleased with this. At this time, I would like to hand it over to Karen Weller for our strategic priority area updates.
Thank you, Robert. During this session, we will provide a broad level overview of each strategic priority area. We will discuss objectives that are currently being met, and we will also discuss objectives that are on track to be met, and lastly, the objectives that have not been met. All right, our CHIP strategic priority area has 123 total objectives. 21 of the Department of Health's programs share the responsibility for reporting on these objectives, and these objectives are reported on a quarterly basis. Overall, 24% of the objectives are being met, 59% of them are on track, and 16% of them have not been met. What I mean by target met is that the objective targets are currently being accomplished. When I say that they're on track, it means that they are not ready, they have not yet been accomplished, but progress is being made in the area. And when I say that targets are not met, it means that we have insufficient data, or the data is not available for us to measure the targets yet, or it hasn't been able to be accomplished. And the next strategic area is health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This is the first time that we are reporting on health equity in our Community Health Improvement Plan. 82% of health equity objectives are on track. 18% have been met, and we have no objectives under the strategic priority that has not been met. Access to care is our next strategic priority. Access to care encompasses all efforts to promote access to comprehensive and quality health care for all Miami-Dade County residents. Access to comprehensive, quality healthcare services is important for promoting and maintaining health, preventing and managing diseases, reducing unnecessary disability and premature death, and achieving health equity for all Americans. Access to care contains the most objectives within our Community Health Improvement Plan, and out of all of the 6 health priorities. 44% of the targets under this strategic priority is being met, the most of any of the health priority areas. 50% are on track to be met, and 8% are not being met. The chronic disease priority area is comprised of objectives devoted to reducing chronic diseases, morbidity, and mortality. Heart disease, stroke, type 2 diabetes, cancer, and illnesses related to tobacco use are among the most common health problems affecting people of all ages, socioeconomic status, and ethnicities. Risk factors that lead to chronic disease include lack of physical activity, poor nutrition, tobacco use, excessive alcohol use, the environment and social determinants, as well as economic factors. All of these contribute to the illness and suffering and early death related to chronic diseases and its various conditions. Under this strategic priority, 15% of the objectives are being met, 80% are on track to be met, the most of any health priority area, and 5% of the objectives have not been met. The next strategic priority is maternal child health. The maternal child health priority area is focused on objectives to improve health outcomes for both infants and mothers. The differences in health outcomes, such as infant mortality by race and ethnicity, can predict future public health challenges for families, communities, and the healthcare system. Under this strategic priority, 27% of the objectives are met, 66% of the objectives are on track to be met, and 7% of the objectives are not being met. Unintentional injuries such as falls, motor vehicle crashes, and intentional injuries such as intimate partner violence are a major cause of death for people ages 1 to 44. However, most of these events are predictable and preventable. Under this strategic priority, 15% of the objectives are being met, 25 of them are on track to be met, and 60% of them are not being met. The injury, safety, and violence strategic priority is the only priority where a major portion of the objectives are not being met. We're just waiting on updated data so that we can have this information. Our last strategic priority is communicable diseases and emergent threats. Emergency response preparation account for threats such as infectious diseases, an example of COVID-19, and natural disasters, another example of hurricanes. There is also an emphasis on providing culturally appropriate educational materials to the public. Under this strategic priority, 19% of the objectives are being met, 62% of them are on track, and 19% of them are not being met. Now I would like to turn over the presentation to our team who will review the success stories we've had in the community.
Thank you, Mrs. Weller. During this session, both Candace and I will highlight our Community Health Improvement Plan objectives that have exceeded expectations. For the first two objectives, we are looking at Health Equity 1.1.1 and Health Equity 1.1.2. So this is by September 30th, 2022, we will increase the number of health equity pre-training knowledge tests from 0 to 1 and post-training knowledge tests from 0 to 1 that can be implemented with all DOH Miami-Dade employees and shared with external partners through media postings, consortium meetings, and trainings. The health equity training was created early 2020 and provides attendees with a comprehensive look at what health equity is and why it's important that we work towards it. In terms of this objective, pre and post-training tests that measure attendee knowledge were created and paired with the training itself. As a result, the Office of Community Health and Planning were able to host 3 trainings in 2020, receiving 99 completed pre-tests and 99 completed post-tests. For our second success story, we will be looking at Injury Safety Violence 1.6.2, which annually ensures that 100% of illnesses and outbreaks that are associated with a regulated facility have an environmental assessment or inspection within 48 hours of the initial outbreak report. Current reporting shows that 100% of complaints have been investigated within 2 days, or report as well as 100% of illnesses and outbreaks or environmental assessments and inspections have been completed within 48 hours of receipt. I will now hand it over to Candace for our next objective highlight.
Thank you so much, Bree. So for the last success story for this section of the meeting, I'll be discussing the objective Maternal Child Health 1.1.1, and this objective reads, by September 30, 2024, we'll work to reduce the Black infant mortality rate in Miami-Dade from 10.8 to 10 per 1,000 live births. And so in 2016, the Black infant mortality rate was extremely high compared to white infant mortality rate. And the Florida Department of Health launched the Florida Healthy Babies Initiative. And this is a statewide collaborative to positively influence social determinants of health and reduce racial disparities in infant mortality. And this project focuses on focus of social determinants of health, approach to close the gap from among non-Hispanic Black and non-Hispanic white infants. And you can see the rates have started to decrease since the statewide Florida Healthy Babies Initiative was launched from 2016 to looking at 2019 rates. And in response to this, in 2016, Miami-Dade County, to these alarming disparities in infant mortality, we held a county infant mortality analysis meeting to review infant mortality rates, examine maternal and infant health factors, and assess the most recent rates with information for social determinants of health. And at this community meeting, there was an open dialogue with the public, community leaders, organizations, and officials to brainstorm really the root cause of this issue and solutions around disparities and developing an action plan to improve the health of all babies here in Miami-Dade County. And these action plan strategies that that came up with the group included increasing health education within the community, reducing STD infection rates among women of childbearing age in order to reduce infant morbidity, and also to decrease the number of new HIV infections in Miami-Dade to reduce infant morbidity, with particular focus on eliminating racial and ethnic disparities in new HIV infections. And the last action plan strategy was to increase the percentage of women who are exclusively breastfeeding their infants at 6 months of age. And so here in Miami-Dade County, we've really used a collective impact approach with many partners in Miami-Dade to decrease these rates, which you can see in the graph. And here in Miami-Dade, we conduct these efforts through the Healthy Baby Task Force, which is a subcommittee of the Children Issues Oral Health Committee of the Consortium for Healthier Miami-Dade. And some of these approaches and efforts that we have done are different social media campaigns to really increase awareness and education on this topic, and really partnering with other partners in the community to spread this awareness through Facebook Live events where we've had over hundreds of views on these events, different community and virtual events. And other educational campaigns that we do focus our efforts on are related to Count the Kicks, safe sleeping, sudden infant death syndrome, and other infant risk. And most importantly, really partnering with local organizations here in Miami-Dade, and to really highlight working with the hospital systems like Jackson and other hospitals in the community, with them becoming baby friendly and taking the steps to become baby friendly. And so overall, this is a snapshot of our efforts we continue to work on here in Miami-Dade County. And as we know, it really takes a group effort to accomplish this great work. And at this time, before we launch for our 10-minute break, we'll go ahead and just share that at this time, we're going to also prepare for our interactive activity discussion. And so also, if you have any questions at this time, you can also put them in the chat box, and we'll be monitoring that and assisting. And we will be using for the activity Poll Everywhere. So on this slide, you have two options to join. We highly recommend using your mobile device, and you will go to either your web browser or you can do a text-in option. And if you're on your phone using the web browser, you would go to pollev.com/chip058, or when texting in, you'll go and text chip058 to the number 22333. And the other option is, if you do use your computer browser, you'll need to use Google Chrome. And for that, the web page is the same. You would go to pollev.com/chip058. And so we will go ahead and leave these instructions on the screen for a few minutes. And if you have any questions, again, please type them in the chat box. And you also have the option to email Robert Ward at robert.ward@flhealth.gov. And we will go ahead and resume back at 10:45. Thank you so much.
Hi, everyone. We'll be coming back from break in approximately 3 minutes. Thank you all for joining us back from break. I hope you all had a chance while we were gone to join the Poll Everywhere software that you can see on our screen. If you haven't, we have 2 options to join. Our preferred method is the mobile device. You can either join using your web browser at the URL below, www.pollev.com/chip058, or you can also text to chip058, and your message will be 22333, and you will be get an automatic text message saying that you'll be able to enter responses. You can also join using your computer browser. We recommend you use the Google Chrome web browser, and you would go to that same URL, and that is www.pollev.com/chip058. If you have any questions, just please enter them in the chat box or send myself an email. That's at robert.ward@flhealth.gov. So we will be using the software for the, not the next section, but the section after that. I'll be covering, let me change the slides here. I'll be covering the targeted areas for improvement. We will discuss 3 objectives from the CHIP that are not meeting the expected benchmarks and target goals that we have set. The first objective we will cover is chronic disease 2.1.2. And this reads, by September 30th, 2024, decrease the percentage of Miami-Dade adults who are overweight from 38.7% to lower than 35.9%. Being overweight is a serious issue because it is associated with poor health outcomes and reduced quality of life. Obesity is associated with the leading causes of death in the United States and worldwide, including diabetes, heart disease, stroke, and some types of cancer. We selected this objective as an area for improvement because this indicator has been stubborn, staying above 38% for 13 years and counting. I will note that the last reported data is from 2016, so we hope to have revised data soon. Current outreach efforts to address this issue have been hurt by COVID since face-to-face meetings are restricted. For example, group physical activity and healthy cooking classes simply aren't possible. On the other hand, due to travel and gathering restrictions, more people are taking time to use remote exercise classes or to go on walks around their homes, for example. Given the importance of improving the health outcomes and the difficulty in doing so, we are hoping more attention and resources from community partners can bring a breakthrough in improving this issue. We feel there's plenty of opportunity for progress on this cause. The next objective we will discuss is Access to Care 6.1.2. And this is, by September 30th, 2024, increase the number of collaborations with partners to develop policies, systems, and environmental changes that will have a positive impact on the needs of older adults from 1 to 2. We wanted to highlight this objective to bring attention to the social needs and health outcomes of the elderly population. Available evidence suggests that COVID-19 affects the elderly population disproportionately, so extra care has been taken to protect this population. However, this has resulted in reduced or eliminated services for elders that provide much needed social and quality of life resources. Some services are transitioning online, but there is still a great need for increased efforts. We are hoping by highlighting this issue that more policy system and environmental changes will be implemented to meet this need, and that organizations will devote more attention and resources to elder issues. A positive example is the Mayor's Initiative on Aging, which currently brings together private and public partners in Miami-Dade County to advocate for elder needs. It focuses its efforts on providing resources and informational programs and activities for seniors throughout the county. The initiative also assists in coordinating educational forums for elders and professionals, health and fitness fairs to promote health, wellness and safety among older adults, and health and hurricane preparedness, education, and kit distribution. This is a perfect example of a change we envision seeing in Miami-Dade County. Finally, we will discuss communicable diseases and emergent threats 1.5.1. And this is, by September 30th, 2024, reduce the number of new HIV infections per 100,000 Miami-Dade from 43.68% to 40% or lower. And that will be below the national and state average per year, with a focus on the elimination of racial and ethnic disparities in new HIV infections. As you can see on the chart on your screen, the HIV infection rate in Miami-Dade County has been roughly 20 points higher than the Florida average for at least the last 10 years. Miami-Dade has unique factors such as socioeconomic inequality, cultural factors, and a large migrant population that make this a uniquely tough problem. The Getting to Zero campaign has focused on reducing the HIV infection rate since 2016. This local campaign has its goal to get to 0 new HIV/AIDS cases, 0 age-related deaths, 0 stigma, and 0 discrimination. Per a 2019 report from the campaign, improvements in prevention and care include routinized HIV testing in emergency departments, moving the linkage to care benchmark from 90 to 30 days, increased viral suppression, and awareness of pre-exposure prophylaxis. However, treatment, enrollment, viral suppression, and pre-exposure prophylaxis uptake remain low. We wanted to highlight this issue since it has been an issue that has been resistant to change and one Miami-Dade suffers severely from. We hope increased attention and involvement from the community will result in further positive change. At this point, I will turn it over to Valerie Turner for our deep dive section.
Thank you, Robert, for that information. For this part of the meeting, we will now begin our objective deep dive activity discussion. During this session, we will be using Poll Everywhere. Take a few minutes to join us so that you will be able to participate in this important community conversation. We recommend utilizing your mobile device by either texting in or using your phone's browser. As we go through the activity today, if you would like to provide additional feedback in addition to your Poll Everywhere responses, we encourage you to please add your feedback to the chat box. You may also raise your hand if you would like to share more information on your response as time allows for this activity. We hope that you were able to sign into Poll Everywhere, and if you are still having issues, please add them to the chat box. We'll give you just a moment to ensure that you are ready to begin. All right, we will go ahead and get started. We have highlighted one objective from each priority area of the CHIP that we want to discuss further today in greater detail. The first one is in health equity, 4.1.1. By September 30th, 2024, a minimum of 2 policy, system, or environmental changes will be in place with at least 2 Miami-Dade County organizations to support shared use paths for all populations with considerations given for modes of transportation, mobility, and age. The first question I'm going to pose to the group is, which key state and local level organizations and/or stakeholders do you recommend helping achieve this objective? I see that we're starting to get some responses in now. So I see hospitals and healthcare providers, urban strategies, great community organizations are popping up here. Jesse Trice, the Department of Health, healthcare systems absolutely are vital. QHCs. Miami-Dade County government. Local nonprofits and funders, those are also key. Parks and Rec. School is definitely important. Another healthcare system, Jackson Health. Service providers, individual doctors definitely play a role. TPO, absolutely. Great feedback, guys. Elected officials. Drug treatment centers. Free clinics. Community-based organizations for sure. Insurance. Faith-based organizations. Faith-based organizations are definitely key in addressing health equity in our communities. Municipalities. All right, I see that we're starting to get some of the same answers being repeated. Chamber of Commerce. So we'll give this here just a few more seconds for any other additional comments or feedback here to show up. Education, absolutely. Individuals. Startup organizations, employers. Thank you all for those responses. We are going to get ready to move on to our next question that I posed for you. What are some best practices that you would like to share or know of that would help achieve these goals? And just as a reminder, if you have additional feedback or would like to provide any additional feedback on your responses, you can simply raise your hand or type that information into the poll, into the chat box. Peer support. Schools. Oh, mentorship is key, absolutely. Engaging the community to help make changes. Very good suggestion. Workforce development. Open dialogue platforms. Absolutely, conversations that we have with each other and organizations will definitely help us meet goals. I see share with other expectations to work together. And I think sometimes this goes to speak of making sure that our work is not occurring in silos and that we work collaboratively across the board. Sharing data, evidence-based practices such as active design, institutional practices, additional outreach activities, attending community meetings and partnering, outreach efforts, absolutely. Collective impact models. There are some really great collective impact models out there. Case studies, complete streets, which we do have active design and complete streets on our website, so feel free to take a look at those as well. Utilizing more community health workers, absolutely. Education. engaging our partners, which is something that we work to try to improve and do through the Consortium for a Healthier Miami-Dade and our additional partnerships that we have through the department. SWATs, commitment, people-centered care model, all great suggestions. Holding individuals accountable, the Walk Safe program. Do we have any other suggestions for this before we get ready to move on to our next priority area? Great, engaging the community members that directly impact versus attempting to determine what is from the top down. Definitely, absolutely, we need to work on that. Community-based research. Health impact assessments. Health impact assessments are really great. I know we haven't done one in a while, but this is certainly something that can help us have a little bit more focus within the community on better addressing the needs of the community. Absolutely. Reporting, tracking. Absolutely. If people don't report, then it's hard for us to track. Return on investment for community and corporate partners. We'll take one or two more responses before we get ready to move on to our next strategic area of access to care. Action planning that encompasses multiple organizations, human impact partners, thank you all for those responses. We're going to go ahead and get ready to move on to our next area, which is access to care. By September 30th, 2024, DOH Miami-Dade will strengthen the Community Health Assessment, or CHA, to assure it addresses older adults' needs aged 65 and above from 7 to 10. So the first question that I pose to you all today is, what are some health issues related to older adults, those 65 and older, that can be highlighted in our community assessments? Alzheimer's, absolutely. Aging in place, and I think this is a big one, especially in light of COVID. Medicare drug donut hole, loneliness. And I think that's the isolation and the loneliness, especially for the older adults, is something that we didn't necessarily foresee when we started thinking of shutting down organizations and programs that our elders participated with. Feeding programs, dementia, caregiver respite is definitely something to be considered. Housing is a big one here in Miami-Dade County. Chronic disease and access to care. Yep. Mental health is a big one across all spectrums for sure. Transportation, technology, heart disease, nutrition, which sometimes I know, again, making sure that meals are being able to be delivered to those that can't make it out of their home, that relied on feeding programs to make sure that they have the nutrition they need. COVID, certainly transportation, dementia and Alzheimer's. And when we think about transportation, making sure that that transportation is able to meet the needs of our older adults. Are they in wheelchairs? Are they in scooters? Do they utilize walkers? Programming, wellness programs, fall prevention is a key idea. Homelessness. And that is important to think of. Isolation beyond COVID. Isolation with this population was an issue before COVID. It certainly is exacerbated because of the pandemic that we're in, but definitely making sure that once this COVID has passed on, that we are able to address this concern. Continuity of care, accessible routes, not enough resources for the elderly, language barriers. And language is something that's very important here in Miami-Dade County because we have multiple languages that are spoken here. Health literacy, the use of community health workers to help bridge gaps, emotional supports, fitness programs, culturally appropriate care, which is again very important because we have a wide variety of cultures here in Miami-Dade County. lack of mental stimulation, on-demand and virtual care. This relates back to that technology component. Community design that makes it safe for older adults to be independent. That certainly also relates back to that aging in place concept that somebody else had mentioned here. Again, as a reminder, if you want to comment on any of the feedback that you all have provided, feel free to put that information in the chat box or raise your hand. The digital divide, barrier knowing, learning, and engaging, limited retirement funds, access to technology, connectivity to both in person and virtually, brain health, that relates back to our Alzheimer's and dementias, volunteer programs. You're getting some really great resources here. High cost of assisted living care. Yeah, those can certainly all be barriers and challenges for our older adult population here in Dade County. Do we have any other feedback here before we move on to our next question? An army of caregivers, absolutely. Holistic evaluations. Family education. And family education is important, especially we know that there are oftentimes multi-generational families, multi-generational households. So educating the family about what resources are available or services certainly can make a difference. Ageism, familial supports, absolutely. All right, we are now going to go ahead and move on to our next question. What other strategies could be used to help link access to care for older adults related to COVID-19? Family support, telehealth, telemedicine, social work. Social work is really important, especially when you're thinking about making sure that an adult that is at home has all the services that they need. Maybe they used to participate in a day program, or maybe they were in an assisted living facility, but then had to be brought back to the back to the home for care. So making sure that there's those services in place. Community health workers. We've seen community health workers throughout some of the questions and responses that you have given. So definitely making sure we tap into that resource. Transportation and the Alliance for Aging. They definitely offer some resources. Educational opportunities for community-based organizations who serve the aging population and family members. Community activities. Family support for telehealth medicine. And right now, telehealth medicine is one of the ways that folks are being able to be connected with their healthcare providers. But if they don't understand how to do it or utilize those platforms, it can make it a bit more challenging to be able to access care easily. The use of media to inform the community about the available resources. The promotion of neighbor to neighbor, I've seen that one pop up. Connecting with places frequented, supermarkets, hair salons, to increase awareness of services, absolutely. Access to home services for those who don't have technology literacy. I see again, media and news. Absolutely. Traditional media messaging like TV and radio. The use of volunteers. I think sometimes we overlook the use of volunteers in some of these different components or aspects, but that's definitely something that we can certainly take into consideration. Part of the problem is affordability of Miami-Dade. If all money goes to housing, it's hard to prioritize, absolutely. The cost of living here in Dade County continues to increase, which is definitely a concern for our older adult population. Increase pharmacy services, collaborate between organizations who are providing services to address multiple needs in one place, kind of like a one-stop shop. That's a great suggestion. Technology accessibility in classes, connecting with nonprofit organizations to promote awareness, collaborative services. Yep, all great suggestions. And a lot of these suggestions are things that can continue during COVID and certainly after COVID. So these are all good interventions that we might be able to utilize. Do we have any other suggestions or comments here before we move on? Transportation coordination that empowers actively commute on their own to appointments. Adults still like to feel like they're independent and have a source and have a sense of being able to accomplish things on their own without always needing assistance. So that's a great suggestion. Block teams, including two older adults, parents, and teens, to strategize and lead information sharing in their area. Peer communication. The Miami-Dade County Public Library to help disseminate information. Faith-based organizations and other nonprofits. Translation services. Absolutely. We definitely have to find ways to incorporate more of our faith-based organizations. 211, visits to the community per zones to identify needs, barriers, in order to identify areas of support and help. Great suggestion. So the next question that I have for you all today is, what social connections are available for older adults in Miami-Dade? Update homes for them to age in place or in their own home. Great suggestion. Do we have some others? Adult daycares. What's that? Adult daycare. Are there any other options out there besides adult daycares that we can utilize to do social connections? Lift centers, multiple senior centers, YMCAs, religious groups. During COVID, online groups. Social interactions through church activities, charities, and volunteers. So again, remembering to loop in that faith-based component. Corner stores. Those corner stores are really big in certain communities, so that definitely could be an opportunity to provide some social interaction. JCS community calendar events like exercise classes, absolutely. We got to spread the word about what's out there. Parks after COVID. Senior groups or programs with parks, virtual support groups. Lifelong learning programs. So this might also relate back to the fact that, you know, we have to make sure that we are aware of what's happening within the community so that we can disseminate and share the resources as well. Parks and Rec, caregivers.com, absolutely, that's also a great resource. Increased internet access, which I know that the access to certain technology, whether it's tablets or having access to the internet at all, sometimes has been a challenge, especially during COVID. Many Miami-Dade County municipalities in the county have affordable senior housing. Again, not enough, but there should be more information sharing on these communities, absolutely. Congregate meal sites, volunteer opportunities, social services and organizations, agency for person with disabilities or long-term care, adult recreation, have volunteers visit elderly, promote front porch events outside at 6 p.m. each Friday. That's a great suggestion. And that's something that can be easily implemented in many communities. Independent living, nurse care, social work, by utilizing those insurers. Large employers to share information with older adult families through sharing with children and grandchildren. That's a great suggestion. Walking groups. I know that before pre-COVID, there were quite a few walking groups that folks could participate in activities. Veteran organizations. I think veterans are a population that sometimes is often overlooked. So I'm glad that somebody was able to put that in here as a suggestion. Absolutely, the United Way. The Elks Lodge and Moose Centers, definitely. Another opportunity to provide that social connection. Do we have any other suggestions in this area? Casual coffee or game gatherings, great suggestion. Alliance for Aging. They often have services and programs that are available or can point them in the direction for where they need to go. Citrus Health. Rotary clubs, another great suggestion for community-based. Miami-Dade college classes. Again, faith-based organization. And consistent connection. I think the point is being consistent and making sure that those options are available for our older adults. So thank you all for those suggestions, and I love the online craft event for that. And we'll read this last one. Healthcare systems themselves can provide opportunities to volunteer, be engaged, as well as serve as a center for information on various community-based programs. Another great suggestion, absolutely. I think our healthcare systems oftentimes see our older adults by providing those healthcare services. So this is absolutely an opportunity for them to be able to promote social connections or interactions with this population. So thank you all for those suggestions. So the next area that we're going to talk about is chronic disease, which is CD 132. By September 30th, 2024, reduced current smoking rates among Miami-Dade adults from 12.3 to 10.5. So the first question that I have for you is, what are some barriers that are preventing the community from achieving this goal? What are some barriers that are preventing the community from achieving this goal in terms of a reduction in smoking? Stress, especially now because of COVID, stress and uncertainty of pandemic times. Social pressures, addiction. Tobacco is very addictive. Advertisements by tobacco companies. Lack of motivation, maybe for those that do smoke. The cost of treatment. Economic problems. Tobacco advertising targeting poor populations and children. Stress. E-cigarettes, absolutely. Lack of language barriers to seek help. Awareness and cultural. Introduction of alternatives to smoking that are likely just as dangerous as tobacco themselves. Vaping has become a problem. Fear of failure, little orientation. And I certainly think that the availability of different ways to smoke, whether it's through vaping or other e-cigarette products, they change often and they change rapidly. So it makes it very difficult to be able to keep up with the changing trends. So that definitely is something that we need to keep working on. Not knowing where or how to access treatment, not having support from those around them, family and generational habits of smoking. And that sometimes is very true with the generational component, especially if there are, again, multiple generations living in a household. It makes it a bit more of a challenge if they all smoke. Availability of targeted cessation programs, agreements of retailers to limit access. Accessibility, absolutely. Social perceptions. Now, I do know that the Florida Department of Health, the Tobacco Prevention Program, as well as our local AHAC, do offer some services related to tobacco prevention and cessation services, and those are readily available on our website. So we will make sure that when we send out the email to all of our registrants that we include some of those resources in there as well. Misconceptions that vaping is a safer option to smoking. Challenges doing exercise and physical distancing. Inaccurate information about the risk and safety of vaping, and the use of media to educate. Absolutely. All really good feedback here. All right, so I'm going to go ahead and move on to our next question. What are some current and future opportunities that can help us achieve this goal related to reducing tobacco use or smoking rates? Incentive programs, absolutely. What type of incentive programs? Tobacco retailer license? Use of social media to spread information and resources. Social media is big, whether it is the TikTok or Instagram or Twitter. There are opportunities for us to share many things on social media and to reach a variety of audiences. financial support to the organizations doing the cessation programs, continual education, and definitely that financial support, because oftentimes these programs will provide some cessation aids for free to those that are willing to participate in the programming. Working with elected officials, implementing local tobacco policy and ordinance, absolutely. Community support and advocacy for smoke-free environments, and actually being able to enforce that when somebody doesn't follow those rules for those environments. Tiered incentives to those enrolled in cessation programs. Work with schools and children on education, educating the community, and educating others about the damage of tobacco products. Informing people of how tobacco can drastically worsen conditions, chronic conditions, such as diabetes, heart disease, and even asthma. Working with our schools, having and ensuring breathe easy spaces, awards given in schools, multi-unit housing, which I know has also been a project of for the department in our tobacco prevention program. Policies around retailing for the youth that are targeting youth. And I think policy changes are going to be one of the biggest ways that we can have an impact in the work that our community is doing for the tobacco and smoking cessation services. Increasing tobacco-free places. Negative impact on the time that takes smoking versus doing something useful and beneficial. More advertisements to inform about tobacco quit your way. Benefits of not smoking and staying tobacco free. This is a good one, working with our insurers and our employers on programs, policies, incentives, and engagement to follow through with not smoking and staying tobacco free. Choice priorities about health to economic, absolutely, sharing those benefits. The benefits for not smoking, role models, having positive role models, especially with our younger youth and young adults, having positive role models that don't promote smoking, that encourage staying smoke-free. Education on the different pathways for smoking cessation and what to expect during that process, and making sure that we get more media involvement in this. This is definitely something that can work in this area. Again, I see some more state policy changes and legislation. I think, again, policy changes and legislation are going to be some of the biggest areas and ways in which we can have improvement in these areas. Do we have any other suggestions? Less secondhand smoke will benefit all residents and the environment, including our beaches. Less litter, absolutely. A lot of times when you go to the beach, you do find cigarette butts, whether it's in cans, buried in the sand, whatever, and it is definitely a big problem at our beaches. Smoking breaks affect the production of performance within working hours, absolutely. All right, so those are all some really great suggestions. I'm going to go ahead and move on to our next area, which is our maternal child health section. Maternal Child Health 3.1.2 by September 30th, 2024, increased the number of presentations on adverse childhood experiences, or ACEs, and plan of care from 0 to 3. The first question that I'll pose to you all today is, what are the best strategies to increase awareness of ACEs and plan of care among the professional and general communities? Oh, great one. Parent cafes and webinars, trainings with CEUs. And I think a lot of our professionals, whether they're licensed or just have a certification that they need to be able to maintain, do require to have those CEUs to continue to stay up to date, from our certified community health workers to our medical providers and social workers. So offering those CEUs, whether it's free or for a small cost, are definitely incentive to participate in these type of awareness trainings. Reach out to colleges and universities, absolutely. Conferences, educate providers, schools, and parents. And then also working with our media. Empower mothers to share their story. Great suggestion. Integration into primary care, and I think that's a big one. Oftentimes, parents and kids will see their physicians, but we have to make sure that we can recognize what those childhood traumas are. Sesame Street and Communities is coming to Miami-Dade and has a component to address ACEs. That's great. Whoever put that in there, we'll try to get some more information or share some more information in our chat box about that. Implement that in our school curriculum, in our culture. Home visits by health professionals, community organizations working together, and implementing workforce training so employees are informed of ACEs. And again, I think the ability to educate and inform and encourage others to understand what ACEs are is something that we have to work on to be able to increase the awareness of that. Early learning centers is definitely a great suggestion. A lot of times outside of parents, our daycares and early learning centers are the ones that spend the most time with our kids. So absolutely a great suggestion. Thank you, I see that. So team, let's make sure we jot down that information right there so we can share that as well as a resource. Parenting classes. At the CEO level, seek to get a commitment to build into priorities and development of staff. Great suggestion. That's our ability to implement and work that into our policy changes. Help to identify available resources and identify the best implementation is the community. We have to work with our community to increase awareness. Any other suggestions here? Faith-based organizations. Again, our faith-based organizations play such a role in many aspects of our lives. So making sure that we are able to loop those organizations in regardless of what type of religion, because folks visit and frequent these faith-based organizations, and if we utilize them properly, they can be a source to disseminate very important information related to ACEs and other information that we're trying to share with the community as well. Partner with foundations to fund partners to work with ACEs and to educate on ACEs, absolutely. Great suggestions. We have time for one or two more suggestions before we move on to our next question, if we have any. All right, so our next question is, which partners and key stakeholders should we be collaborating with to increase awareness of ACEs? So we know we need to increase awareness about this topic, but who should we be working with? Who should we be collaborating with in the community to be able to meet this need? And it can be a partner, insurers, kid care plans. Absolutely, that's a great suggestion. Pediatricians, the school board, Miami-Dade County Public Schools, healthcare systems, and each one of these suggestions that you all have made are definitely something that work closely with kids. They see kids on a regular basis. Department of Children and Family Services see kids and families. So these are all great partners to be able to have. Primary care providers and daycare centers, nonprofits, consultants. Yep, absolutely. Community clinics. Organizations that provide services to mothers and children. Technical experts. University, FIU has a great presentation. Family Cafe Council. Adult recreation centers. DCF, accrediting body for the Early Childhood Center, universities that are doing research around ACEs, and other parent organizations. Again, all great suggestions for us to be able to start reaching out to and partnering with. Parks and Recreation, great suggestion. Parents and children spend a lot of times in those communities, parks and rec centers. Center for Community Resilience, George Washington University, that seems like a great resource, and we could do a little more research for that. After school providers, great suggestion there. Mommy and Me groups. Child care facilities. MH care providers, mental health providers, parenting classes. WIC is another great suggestion. They see our moms and babies regularly. Schools of social work, absolutely. The Children's Trust is another great solution. HIP, Health Info Project, active in 100% of high schools. Stores that sell goods like Bye Bye Baby, Ideal Baby, and Target. Great suggestions. 211. The Club of Kids. Thriving Minds of South Florida is coordinating the local Sesame Street and community efforts. Community recreation centers, foster care, absolutely. And I believe foster care might be a little bit more in alignment with working with our DCF to kind of get that connection going through there. Children medical services and the judicial system. Yep. The police department, great suggestions. NAMI. Pediatric mobile units, another great suggestion, as well as the homeless trust. We have quite a few homeless families that include children here in Miami-Dade County, so absolutely we need to make sure that we're looping them into this conversation and discussion as well. Other corporate retailers. Thank you all for those suggestions. These are really great feedback that you all have been able to provide for us. So we will go ahead and move on to our next question, which is which partners and is our injury, safety, and violence. 4.1.1. By September 30th, 2024, reduce the rate of deaths from all external causes ages 0 to 14 among Miami-Dade resident children from 5.0 per 100,000 to 4.5 per 100,000. The top 4 leading causes of unintentional injury, death for children aged 5 to 14 years old are motor vehicle traffic crashes, drowning, falls, and fire. What are some potential strategies we could use to reduce these rates? Again, the top 4 are motor vehicle crashes, drowning, falls, and fire. Create safe streets, absolutely. Encourage the respect towards others. Free car seats and swimming classes based on needs. Using the media to educate. And definitely the use of car seats and swimming is something that is very important. I've seen, even driving in traffic from time to time, you'll look over and you'll see a car that has several kids and they don't have the kids are not in car seats, which is very concerning. Mandatory parenting classes for new parents, peer-to-peer education, child abuse prevention, swimming courses, change inspection policy regarding existing home purchases to ensure that pools have safety barriers at the time of purchase. Absolutely. Car seat checkup events with certified child passenger technicians, educating harms through large media outlets, fall prevention, respecting pedestrians. That's something that we have challenges with here in Miami-Dade County. I think oftentimes we see on the news, hit and run accidents and things like that, whether the driver was not paying attention or pedestrians are not utilizing crosswalks or their streets are not marked. So that's definitely something that we need to examine. Swimming class prescriptions, I like that idea. It kind of coincides with our use of the green prescriptions for more physical activity. PSA with testimonials, how to manage the anger, promote more public transportation and school education programs, having some more social media around some of these topics, which again is very important. We are able to utilize social media, so we certainly need to ensure that we're doing that to the best of our ability. More awareness of cell phone and driving, volunteer community service projects with nonprofits to increase protective factors and decrease risk, absolutely. Do we have any other suggestions? Fire safety is not discussed as often anymore, even in schools. That's true. I remember growing up in schools, they taught us about fire safety. We went to a place called Safety City where we learned about exit routes from homes and things like that in the event of a fire. So definitely education in schools, education in person. educating elected officials of these issues to create better policies, understanding that stop, drop, and roll for sure. These are all great suggestions related to these topics. So the next question that I have for you is related to our CDE, Communicable Diseases and Emergent Threats 1.1.1. By September 30th, 2024, increase the percentage of 2-year-olds who are fully immunized from 93.1% to 95% in Miami-Dade. So the first question is how has COVID-19, in addition to concerns and misconceptions about vaccines, impacted immunization rates among 2-year-olds? Marketing campaign on vaccine safety and addressing the anti-vaxxer messages. Great comment. Using the media for information, absolutely. There has been an increase in false info with some more need to fact check. So overall, I think there has been some concerns related to the use of vaccines. Here at the Department of Health, we do have an immunization program that continues to operate. So in making sure that people understand the importance of immunizations for their children. This is difficult. Latinx and Blacks across all SES have misconceptions. We have some less well-care visits, fear of getting infected with COVID-19 with going to health centers. We have to build trust, school supporters, concerns about safety of physicians' offices going to get vaccine due to the risk of COVID. We have to promote our literature. We need to explain the vaccine process, and we need to get the facts out and try to reduce some of those misconceptions. So great feedback there. Services during COVID are by appointment only. Need walk-in services. Build trust in the development and impact. Trust. I see trust is a big concern, and it has come up here a couple of times. So that's definitely something that we need to take a look at and see how we can continue to increase and improve the trust of the vaccines in our medical community and share that with our residents. Need off-hour availability of vaccines, evening and weekends. Vaccine accessibility. More vaccines everywhere. Absolutely. So the next question that I have for you all this afternoon or this morning, what are some potential strategies that the community can use to address these concerns in order to improve immunization rates among 2-year-olds? So any strategies or suggestions that we have, all for drive-through vaccines like the flu shot events that are taking place? That's a great suggestion. Right now, there's a lot of drive-through events happening in the community, whether it's drive-through food distributions or drive-through COVID testing. There's a lot of drive-through things that are happening. Social media, marketing campaigns on safety of the healthcare provider offices, and working with our local not-for-profit hospitals have partnered on initiatives similar to this. WIC qualifications, educate the parents, again, having more different hours, offer small gift cards to like Publix that offer small gift cards like Publix is offering for flu shots, more community immunization events, educating students and parents, set up vaccine tents at parks. That's another great suggestion. Meet them where the families already are, in schools, daycare centers, etc. Provide incentives to parents. Health team visit the neighborhood. That's a great suggestion. Go to their homes. Share reputable evidence and results that immunizations are proven and effective against vaccine preventable disease. Absolutely. Education and good, proper education that reduces those misconceptions, and all the lack of good information out there is definitely important. Provide near grocery stores, highlight no-cost wellness visits and the vaccine cost, offer a tax break. Any other suggestions? Raise awareness of safety protocols. It is safe to go to the pediatrician, absolutely. Strengthen expectations, exemptions. Promoting the need for the creation of holistic vaccines that remove some of the harmful chemicals that people are afraid of. So that goes back to the creation of those products. Call mothers prior to the appointment to build rapport and answer questions, and explain COVID safety measures. Those are great suggestions. And those COVID safety measures may vary from provider to provider, but they all should be based on CDC recommendations, which are readily available on the CDC website, as well as our Florida Department of Health website as well. Vaccine events at libraries, another great suggestion. So thank you all for those suggestions in this area. Have education materials available in multiple languages. Absolutely. Good distribution of the resources in the state. And we have time for maybe one more. At multi-unit housing, absolutely. Those sometimes have larger gatherings of folks and families and kids. So that would be an excellent opportunity for us to be able to use vaccines there. So I want to say thank you all for the feedback that you have shared from today's conversations. And it will all be used to update the CHIP annual report that evaluates the current status and progress that we are having in the community. Thank you all so much for participating in these conversations and providing your feedback. I will now turn it over to Robert for the next steps with Mobilizing for Action through Planning and Partnership, or our MAP process, and the Community Health Improvement Plan. Robert?
Thank you, Valerie. So I'll briefly discuss the next steps in the MAP cycle. First off, the revised CHIP and the CHIP annual progress report are due in March of 2021. We do not expect any significant alterations to the CHIP since a revised version was submitted recently in September 2020, as I discussed previously. The MAP cycle will renew in 2022. The current cycle began in 2017, so we're ending the end of our current cycle, and 2021 will be our planning for that next cycle, which will begin in 2022 and conclude in 2027. Finally, the MAP Steering Committee will meet in January 2021. Again, we'll begin the planning process for the MAP cycle in 2022. So at this point, I will hand it off to Brianna for our meeting evaluation.
Thank you, Robert. Today has been an incredibly productive meeting and an amazing CHIP webinar. Our work today will aid in the development of the updated CHIP action plan and progress report. I want to take the time to say a very large thank you to our attendees and the community. Before we end this webinar today, we wanted to share, once the webinar is completed, the meeting evaluation will automatically appear on your screen. We encourage your feedback for future development of other community events. The collective power of our community partners and leadership is necessary to help us move forward. Only by working together can we make a difference. To improve the health status and outcomes of our community, we must continue to work together across multiple sectors. The impact and success of encouraging community change requires our collective effort. As you've learned today, the CHIP was designed to encompass a broad representation of stakeholders, with the CHIP, hospitals, public health agencies, nonprofit organizations, businesses, coalitions, community organizations, and members can understand our community's most pressing health needs and become involved in the solutions. The plan can be used as a reference for decision-making and a basis for designing programs. Organizations can align strategic priorities for community change and lasting health improvement in participating in CHIP activities and provided its leadership and organizational home. I would like to invite you all to become a member of one of our consortium committees. The consortium will be the platform used to implement CHIP action plans. I encourage you to visit our site at healthymiamidade.org to register as a member. Improving the health of our community will require a collective effort. To successfully implement the CHIP enhance health outcomes, and avoid duplication of efforts and allocate resources most effectively, collaboration is key. It will take all of us working together to identify and support the positive changes already happening in our community. The Florida Department of Health is committed to protecting, promoting, and improving the health of all people in Florida through integrated state, county, and community efforts. Please continue to join us as we strive forward. Together, we will see a healthier Miami-Dade County. Once again, the meeting evaluation will automatically appear on your screen. We encourage your feedback for future development of other community events. Thank you and have a wonderful day.